Hello, my name is Victoria Giehl, and this is my Capstone and 5-year plan. My professional bio sketch. I am currently working as an infusion nurse for a specialty pharmacy. My area of specialty is cardiopulmonary nursing, and I've worked in this role since 2008. My role includes teaching patients and their families to manage a continuous intravenous therapy until independence is met. These medications are life-sustaining for the treatment of pulmonary hypertension. I was previously employed as a registered nurse with Methodist Hospital in the Houston Medical Center. I worked there from 2006 to 2009 and performed duties such as charge nurse, mentoring newly hired nurses, and participated in committee activities and education to all staff. I obtained chemotherapy certification for the treatment of patients who were post-transplant and were diagnosed with cancer. I also cared for patients pre and post lung, kidney, heart, and liver transplant. I trained in the management and care of patients with LVADs, left ventricular assistance devices. I graduated from Houston Community College with an associate's degree in nursing in 2005, and I have a baccalaureate degree in nursing from Lamar University in progress. Graduation to occur in December 2018. The first construct I am going to cover is Humanity and Society, which covers practices safe and effective holistic patient care, centered care, to a variety of patients and clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. I felt this construct was met in Nursing 4316 Comprehensive Holistic Health Assessment. I completed Healthy People 2000 objectives, and this paper focused on reducing episodes of infection by implementing objective focus on infection reporting process and identified staff educational needs. This also incorporated cultural and educational factors that may hinder implementing objectives using evidence-based research. Systems assessment in shadow health was also completed in this course with comprehensive system assessment and documentation reporting findings. Nursing 4540, Care of the Communities, also addressed this construct in the assignment of project planning and windshield survey. This assignment identified an at-risk aggregate that was elderly and included interviews about the population's views on health, safety, community services available, their transportational needs, communication, and education. The windshield survey consisted of a survey of the area and identified risk or potential risks to the population. In Nursing 4321, Nursing Theories and Online Education, a philosophy paper was completed that outlined my personal nursing philosophy and compared it, contrasted it to the theories written by Nightingale's philosophy and modeling and role modeling theory. This construct, our objectives were met with 98.5%. Lifespan Health Continuum construct covers supporting patients and clients in preventing disease, maintaining wellness, and promoting and restoring health and advocating for death with dignity. I felt this construct was met in Nursing 4540, Care of the Communities, in the epidemiology assignment. This assignment looked at evidence-based health promotion in public schools to improve physical activity and healthy eating, not only in the school, but when kids were at home with their families. This construct was also addressed in Nursing 4620, Caring for the Patient with Compromised Multiple Health States. A discussion post that I completed covered the management of postoperative patients' pain. This post was evidence-based, and it looked at caring for patients with postoperative pain and the importance of managing pain to improve their quality of life and their clinical outcome. Practical reflections 1 through 4 were also in this course. These reflections compared and contrasted a patient interview diagnosed with non-Hodgkin's lymphoma and a memoir written by Kyle Gartlett. He was also diagnosed with non-Hodgkin's, but at a very young age, and went on to develop leukemia and then had to have a heart transplant. due to damage to his heart. It was both, one was diagnosed very young and one very old, but both suffered from surviving cancer. And the cloud that kind of hangs over your head, worrying about reoccurrence. Lifespan's health continuum construct evaluates patient-centered care for patients and clients across the lifespan based on common and complex health needs and compromise multiple health states when considering multiple detriments of health. Nursing 4316, I felt, met this construct with comprehensive holistic health assessment. The systems assessment in shadow health allowed for multiple patients from pediatric to elderly to be assessed and then document findings. Nursing 4540, Care of the Communities, a project teaching plan was completed. This assignment identified a vulnerable senior aggregate lacking a defined emergency disaster plan. This population's age ranged from 67 to 83 years old. Many had multiple illnesses and physical limitations. The teaching plan encouraged proactive planning to ensure individuals had medications, assistive devices, an actual plan in place that incorporated their families, neighbors, or friends, and identified supplies needed to have on hand in the event of a natural disaster. Nursing 4620, Caring for the Patient with Compromised Multiple Health States. A community-based service learning assignment was completed. This PowerPoint assignment was completed on a patient with acute lymphocytic leukemia. An interview was conducted over several sessions, and areas were addressed to improve or maintain his health, utilizing community resources, the patient's treatment center, all addressing the patient's verbalized concerns. This objective was met at 98%. Evidence-based practice and clinical reasoning construct includes synthesis, clinical, and judgment in nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice. I felt this construct was met with Nursing 4550, Practice, Leadership, Management, and Healthcare. A clinical application paper was completed that identified policy improvement strategy using the nursing process in my current clinical setting. The policy improvement required the company to provide nurses with physician's orders and patient demographics with each shipment. This process allowed nurses to have valuable information on hand in the event they were unable to access the electronic devices that would cover their physician's orders, medication to be given, pre-meds, post-meds, hydration orders, so that the best, most safest care could be given to the patients. Nursing 4390, Nursing Inquiry Evidence-Based Practice. A quantitative research article critique was completed. This was a group project that reviewed an article discussing burnout and engagement and the effect it has on workers in multiple settings. Burnout, of course, causing massive turnover if not addressed, and engagement employees decreasing burnout and increasing nursing or job satisfaction. This objective was met at 91%. Patient-client-centered care. This construct covers employs safe, effective, patient-centered care using theory and evidence-based findings in collaboration with patients, clients, and members of the interprofessional and intraprofessional healthcare team. In Nursing 4580, I felt Synthesis of Professional Nursing Capstone met this construct with discussion of one of Baby William. This discussion outlined interventions institutions could implement to improve their culture of safety. These interventions included education of the staff, providing tools and resources and training specific to pediatric medications, the dosing, and the administration needed to provide care safely and reduce medical errors. Nursing 4321, Nursing Theories and Online Education, Paradigm Case Number 2. In this paradigm, 2 incidences were described during shift change that led to policy changes. These interventions were established by nursing administration in collaboration with staff nurses and research of evidence-based research. Nursing 4550, practice leadership management in healthcare. Healthcare delivery. This discussion post addressed a patient refusing a specific nurse due to religious concerns, and it also discussed a patient whose family completed all of the patient's tasks and daily activities by encouraging them to allow the patient to do more self-care so that he could be more independent and involved in his own health care. This objective, I feel, was met at 97%. Professional roles construct differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients or clients as a member of the interprofessional or intraprofessional healthcare team. I felt this construct was met with Nursing 4321, Nursing Theories and Online Education. Differentiated Essential Competencies paper was completed. This paper incorporated both educational standards developed by the Texas Board of Nursing and research. The assignment compared how the ADN and the BSN would respond to a patient fall. The ADN, in my paper, would gather data and then implement interventions, whereas the BSN would gather data and implement interventions using evidence-based research. The purpose was to provide the most safe and effective patient care using evidence-based practice and to show that the BSN often had a broader outlook when providing care. Nursing 4390, Nursing Inquiry Evidence-Based Practice. Discussion 1 was completed on the Tuskegee syphilis experiment. This post discussed the ethical principles that were violated by the health community, the nurses, the physicians, and staff by denying the patients his fundamental rights. This objective I felt was met at 95%. Professional roles construct demonstrates professional integrity, effective communication, active inquiry, and service to the community. This construct I felt was met in Nursing 4550, Practice, Leadership Management in Healthcare. A global health PowerPoint was completed that focused on the International Council of Nurses. The ICN acts globally to advance the profession of nursing and to influence healthcare policy. It also encourages globally nurse collaboration in regards to healthcare policies, research studies that are being conducted, and training. Nursing 4540, Care of the Communities, a CBLS, Civic Pride and Diversity Initiative, was completed. This PowerPoint presentation on Pulmonary Hypertension Association addressed my personal involvement volunteering at awareness events. I also provided education on oxygen fire safety, signs and symptoms of a line infection, and community resources available to patients and their families. This objective, I feel, was met at 99%. My 5-year plan. In 2018, my plan is to graduate from the RN BSN program and apply for a cardiopulmonary nurse specialist role within my organization. In 2019, I would like to have obtained my certification in Certified Nurse Infusion, CRNI, as I am an infusion nurse and this is currently my specialty. In 2020, I would like to complete my MSN, my Master's in Nursing in Education. I am also looking at informatics, but am currently leaning toward education. In 2021, I would like to apply for a position within the teaching hospital as a nurse educator, preferably in a cardiopulmonary focus. In 2022, I would like to become an active volunteer for the American Red Cross, specifically in disaster preparedness. Once my education and my new role is established post-education, I would like to spend some quality time volunteering for an organization such as the American Red Cross, and specifically disaster preparedness Historically in Houston, we have had multiple disasters with flooding and hurricanes and tropical storms, and the lack of preparedness in individuals, especially vulnerable individuals, is needed. The education is needed. I thank you for your time and allowing me to present my 5-year plan and my capstone. And following, these are my resources, my references, and thank you again.